myself, my co-host, Mariyana Spyropoulos, and our supporting organizations, Metropolitan Water Reclamation District, Illinois Department of Public Health, the Chicago Engineers Foundation, and Argonne National Laboratories. We want to thank you for joining us over your lunch hour for this very timely conversation about COVID tracing and wastewater. It's something that I learned about early in the pandemic. I think it's an incredibly exciting tool to be fighting COVID. And we are excited at MWRD to be part of some very early pilot studies on this topic and to be part of continuing to explore what's possible in terms of COVID tracing and wastewater and to really be part of the solution. So thank you everybody for joining us, and I'll hand it over to my co-host, Mariyana Spyropoulos.
Thank you, Josina, and welcome everyone. Welcome today to this very important town hall. I want to thank my colleague, Commissioner Morita, and our staff, Tom, Chiquina, and Carl, for all your work in putting this together. There's so much misinformation out there about COVID, so we thought it was important to talk to the experts. Dr. Ngozi Ezekie from IDPH and Mark Grippo from Argonne. And we thank them for sharing their knowledge today. You know, there's a lot of people out there who are still hesitant to get the vaccine. So I think it's important that we're going to get the experts to talk about that today. And just being informed is a crucial factor in fighting this pandemic. So thank you again for everybody. And I'm looking forward to the conversation.
Thanks, Mariyana. So I'm going to go ahead and get into it and introduce our first speaker. Dr. Ngozi Ezekie is the head of the Illinois Department of Public Health, where she has been for over 15 years, promoting the organization's mission of delivering integrated health services with dignity and respect, regardless of patients' ability to pay, which I think we all appreciate, especially in these times. She is a board certified internist and pediatrician, where she's delivered inpatient care at Stroger Hospital, as well as primary and preventative care in community and school-based clinics. My mom was a physician's assistant and worked in a community clinic that was primarily Spanish speaking. So I completely appreciate all of the different roles that Dr. Ezike has played, and what I think makes her so great in her role, especially right now. As medical director for the Austin Health Clinic located on the west side of Chicago, she engaged with the community through health initiatives involving a lot of key racial health disparities, including obesity, diabetes, and breastfeeding. In her last role with Cook County Health, she served as medical director at the Cook County Juvenile Detention Center. She graduated with honors from Harvard University with a concentration in chemistry, very impressive. Her medical degree is from University of California, San Diego, where she completed her internship and residency here in Chicago at Rush Medical Center, where she is still an assistant professor of pediatrics. And she also earned her management certificate from Harvard Business School. But more importantly, I think we've all gotten to know Dr. Zeke and really appreciate her leadership as a leading and reliable, trustworthy voice through this pandemic. I know when I see her at these press conferences, I'm like, okay, you've heard it all, but what does Dr. Ezike have to say? And really appreciate it. You know, as a woman of color in particular, also just appreciate seeing her in this leadership role and really leading us through this moment. So we thank you, Dr. Ezike, for your work. And you're just kind of calming and reliable presence and leadership over this last year. And thank you for joining us today for this conversation. So thank you, Dr. Zeke.
Thank you, Ms. Morita. That was super, super kind. I really appreciate your kind words. So can I give a quick introduction to kick this off? Okay, so good morning, everyone. I guess it's afternoon now. It has struck 12, and I want to thank all the commissioners for inviting me to join this panel. IDPH is continuing its efforts to protect every single person who calls Illinois their home and trying to knock out COVID-19 within our great state. Our focus continues to be on getting as many individuals as possible to take the vaccine. We have seen that it was 90+% effective in trials, and it's also that effective in real life, which is tremendous. So we need to get people vaccinated, but we also need to continue other key methods of testing, maintaining social distancing and masking when that's appropriate, especially if you're not vaccinated. Without question, vaccines are the best way to prevent severe disease, hospitalization, and death. Before, we said our best defense was our mask and washing our hands, but now we have not one, not two, but 3 safe and effective vaccines that are more than 90% effective. And we are seeing that the effectiveness rate is also applicable to the variants that we are currently seeing. So that's incredible news. So because the vaccines are so effective, anyone that is fully vaccinated, and just to be clear, you know, I'll see a lot of people, they say, oh, I got my first shot, and then they think I'm good. Like, you have to get fully vaccinated, which means having the final dose, which is the second dose for the Pfizer and the Moderna, or, you know, 1 dose for the Johnson & Johnson, and wait 2 weeks after that final dose. And after that point, yes, the CDC has said, and Illinois will follow suit, that you can participate in indoor and outdoor activities without wearing a mask. But being fully vaccinated means that you're protected. And so you can resume so many of the activities that have been put on hold for well over a year. And in addition to our efforts to get as many people as possible vaccinated, IDPH is continuing to study this virus because it is still with us and still might be with us for a while. The idea of completely eradicating the virus is still ways off, if at all. And so we still need to learn as much as we can, and we still need to make sure we stay on top of eliminating its deadly threat potential. And so one of the most recent research efforts is wastewater surveillance. The reason why this is so effective for SARS-CoV-2 RNA is actually shed in the stool of individuals before they develop any symptoms. It's also shed while they are symptomatic, and even for those who develop an infection and never develop a single symptom, they still will shed the SARS-CoV-2 RNA into their stool. So wastewater surveillance can provide a much broader picture of community infection than just the clinical data and waiting for people, you know, to come and get tested after they develop symptoms or not. And so because of the shedding that occurs even before people have any symptoms, you have an earlier identification of infection in your community. And when you think about the time it would take to, if somebody develops symptoms and then, maybe a couple of days later they say, is this COVID? And then they may be scheduled to go get a test. And then it takes a couple of days to get the test result. You can see that the wastewater information could give us almost a week's worth of lead time prior to what you would get from testing data. So we'll be able to collect samples from wastewater treatment plants. We'll be able to conduct laboratory and data analysis and even perform genomic sequencing. So we're super excited about this new opportunity to study this virus. It will help us better protect the people of Illinois. And we are going to begin this surveillance within just the next few days. And our plan is to start collecting samples from 10 treatment plants initially, but by year's end, we'll be collecting from 150 sites across the state. So really excited about this, really excited to be partnering with so many people on this important project. I'll stop there. I know we have other panelists and I'm happy to answer questions when it's the appropriate time. Thank you.
Thank you so much, Dr. Zeke. I proudly got my second shot 2 weeks ago. And I thank you for that, very personally. I think it's very personal for a lot of us. I'm finally, after my 2 weeks, going to go to California, see my 96-year-old grandmother, who will meet my 1-year-old daughter, who was born the day that we went to shelter in place for the first time. So it's such a great gift, this vaccine. And we continue to do outreach to remind people not only to go get vaccinated, but to get that second shot so that we can all go back to those moments. It's so meaningful. So thank you for that. And it's amazing, like you said, what wastewater testing and wastewater can do, both for these, kind of changing variants and the early detection. I know that some of the challenges have been around like young people going to get the vaccine. And I've heard about these models of doing the wastewater testing by dorms, in colleges and places like that, to help us kind of get on top of the spread, particularly among populations that maybe are not getting vaccinated at the rates that we would like to see it. So thank you so much. We'll have Mark speak, and then we'll go to Q&A for both of our speakers. So I'll hand it back over to Mariyana to introduce Mark.
Thank you, Josina, and thank you, Dr. Ezike, for the update. I just did want to add that so many people I know were always wondering, okay, what is Dr. Ezike going to say today, and sort of base their decisions and plans on what you were saying. So just want to add that and make sure that you know that we see you as a beacon of light and sort of guiding us through this pandemic. So our other expert on this call is Mark Grippo. He's an ecologist at Argonne National Lab, working in the Environmental Science Division. His work experience and academic training is in evaluating and impacts of human activities on aquatic biota and ecosystem processes. He co-led a 7-year MWRD funded study of the microbiome of the Chicago area waterways to understand changes in the bacterial community following the implementation of a new wastewater disinfection and the opening of new phases of the tunnel and reservoir plan. The project also involved using machine learning to predict fecal coliform levels in the Chicago area waterways under a given set of environmental conditions. And for the Walder Foundation funded PCANN project, he's leading the sampling design portion of the project, which involves working with MWRD and Chicago Department of Water Management to identify optimal sewer sampling locations citywide. So thank you, Mark, for joining us. And I'll let you take it away. Talk about wastewater surveillance of COVID.
Okay, thank you. Yes, so today I'm going to talk about the Chicago Prototype Coronavirus Assessment Network Node. It's a long name there, PCAN for abbreviation. And this is being funded by the Walder Foundation, based here in the Chicagoland area. And as you can see, there are a lot of individuals and organizations involved in this project. So it's being led by Charlie Catlett at the Discovery Partners Institute at UIC. We have Rachel Peresky leading the genetic analysis portion of the project, also at UIC. Wilnice Jasmine at Chicago Department of Public Health and Sam Dorvich at UIC are looking at the epidemiological aspects of the study. Aaron Packman is working on the modeling aspects, components of the study. And I'm doing the sampling plan development. So again, a lot of different organizations, very multidisciplinary. You can go to the next slide. Yes, so this project falls under the field of wastewater-based epidemiology. And the basic idea there is that individuals, when they become infected with the bacteria or virus, they will shed the genetic material of that infection in the stool, and therefore it can be detected in wastewater. So it's really important, it's really advantageous because you can get an idea of community level infection with just one sample from just one wastewater sample. So you don't have to sample a huge number of people. You can just use one sample to get an idea of this community level infection. So because of that cost effectiveness, it's been used a lot in countries that don't have a lot of resources. It's been particularly used for years now to monitor polio infection, for example, norovirus infections. There's a lot of other applications as well. biomarkers of public health that this approach can be used with. So in addition to that community level perspective, another big advantage is the lead time that was alluded to earlier. So SARS-CoV-2 is shed from the onset of infection. Oh, you can go to the previous slide. Yeah, so SARS-CoV-2 is shed from the onset of the infection 3 to 4 days prior to symptoms that would prompt an individual to be tested. So basically, asymptomatic, non-symptomatic, or symptomatic individuals are all shedding this virus. And because pre-symptomatic or asymptomatic individuals shed, it can be detected in wastewater before you see that manifested in the caseload data, so the individual testing data. And the literature suggests that these lead times can vary quite a bit, you know, from up to a week, sometimes it's only a few days, but there is usually this lead time that's found, which can be very important for public health officials. And then globally, studies do show that the wastewater level, the wastewater data does track community infection very well. So you'll see again an increase in the virus in the wastewater data, and then you'll see an increase in the virus in individual testing data or the clinical data. And that's illustrated here on this figure to the left. This is a figure from the Hampton Roads area, which is one of the first applications of wastewater-based epidemiology to the SARS-CoV-2 virus. And you can see that as the viral load in wastewater increases, the clinical test numbers increase as well. And there's actually a bit of a lead time there of up to a week. So again, the trend line increases in the wastewater, and then up to a week later, you see increases in the clinical data. So again, takeaway is two big advantages of wastewater-based epidemiology. From one sample, you can get a community level understanding of infection, and you have this lead time. Gives you time to act in the community. Can you go to the next slide? So here's what we're doing for this project. We're collecting wastewater samples from sewers in Chicago, as well as wastewater reclamation plants. We're also evaluating and optimizing methods for detecting SARS-CoV-2 and genetic sequencing. And genetic and sequencing is very important because that's how you detect the variants. Everyone has probably heard in the media, there are variants of this virus, and we want to make sure that we can track those and see what they're doing. We're also using computational modeling techniques to map the viral load within sub-sewer sheds and model viral transport through the sewer system to identify source populations. This is another really important one. Estimate how the viral load of SARS-CoV-2 in wastewater relates to COVID-19 infections and the associated population. So this is what a lot of people are working on. It's a difficult, challenging question. As you can imagine, there's a lot of things that affect SARS levels in the wastewater versus the human population. So just the basic structure of the sewer system, water temperature, a lot of different factors can affect the degradation rates of the viral RNA in the sewage system. So it's complex relating that back to the actual infection levels in the population. But there's a lot of effort going into this question. It's very important. Obviously, if we could predict community level actual infection rates based on just the sewer samples, that'd be very, very valuable. We're also sharing our data in real time with CDPH, Chicago Department of Public Health, to inform their decision making. And we potentially, this project could serve as a node in a nationwide wastewater surveillance system. So the NIH is looking to develop this system. They already have kind of brought it online. They have several cities involved. And this is going to go on into the future. This is going to go way beyond just COVID. This will be a future effort to track not only viruses, but also just community health in general. Go to the next slide. So where we're sampling. First of all, we're sampling at wastewater reclamation plants. Argonne has a long relationship with MWRD, and they've been very helpful throughout this project. They were right there at the beginning, sending samples to Stanford University right at the outset of the pandemic. They began sending us samples as soon as we asked, so they've been a great partner in this. We're receiving samples 1 to 2 times a week from Stickney, O'Brien, and Calumet wastewater reclamation plants, and also several WRPs in the suburbs as well. We're also sampling, or we're going to begin sampling in the city of Chicago. So the 3 wastewater treatment plants, Stickney, O'Brien, Calumet, they service the suburbs and the entire city of Chicago. So because they service such a large area, that doesn't necessarily give us the community level resolution that we'd like. That means we have to sample actually manholes, individual manholes within the city of Chicago. So for that, we're working with MWRD and the Chicago Department of Water Management to identify the optimal manhole sampling locations. To again, get the idea of these smaller community level infections within Chicago. We're also sampling at Cook County Jail, the sewers there. And we're about to begin sampling at O'Hare International Airport. There could be obviously an international origin to some of these pandemics, so it would be important to sample at O'Hare in the early stages of a pandemic. And we're also going to I'd like to start working with Illinois Department of Public Health to implement this wastewater treatment sampling statewide. There is vaccine hesitancy in parts of the state, so we want to make sure that we can actually look at the rates of infection, again, statewide, also track variants as well. Go to the next slide. I'm going to discuss a little bit deeper this idea of spatial resolution and sampling. So on the figure to the right, you can see that there are hot and cold spots, so COVID hot and cold spots in the city of Chicago. And this is based on the individual test data that Chicago Department of Public Health has provided. So infection rates are not uniformly distributed throughout the city. There are hot spots and cold spots. So we want to, again, because these wastewater treatment plants service such a large area, we can't really get resolution with the sewer data by just sampling these wastewater reclamation plants. We actually have to sample within the city in individual, sub-sewer sheds. That's what's illustrated there on the figure to the left. This is the blow up of hotspot number 1. And you can see there that there are 5 sub-sewer sheds identified within that hotspot. And by sub-sewer sheds, I just mean that the area that an individual manhole drains, the population that flows into that individual manhole location. So again, by sampling that individual manhole, you can get an idea of community infection within that entire number 4, 5, whichever sub-sewer shed you're interested in. So again, you can get a very high resolution of community infection level, sampling that individual manhole. So that's really important. And this is also very unique for this project. Very, very few of these wastewater-based epidemiology studies look at sampling this level of resolution. Most of them just sample wastewater reclamation plants. So we're getting a much finer level of resolution with this. But there's also, as you can imagine, a lot of logistical challenges to sampling an individual manhole. Everything from traffic to a car parking on top of the manhole. There's a lot of logistical challenges to this. But it's really necessary, especially in Chicago, where you have wastewater reclamation plants that cover such a huge area. I think Stickney is one of the largest in the world. So a lot of other cities have much smaller service areas for their wastewater reclamation plants. Go to the next slide. And this is just our basic laboratory workflow. So we collect a sample, we filter the sample, concentrate it, we do our RNA extraction, and then use quantitative PCR to come up with the COVID-19 gene copies per liter of wastewater. We're also starting to do genetic sequencing on these samples. And again, that's really important to detect the variants. And we're also preserving a portion of our samples for retrospective analysis. So like, for example, it would have been great if we had started doing this, early in 2019, because then we could have actually seen when SARS first appeared in Chicago. So it's important to have this database of older samples, this archive of samples. And you can go to the next slide. And this is just an example of how this data can be communicated to the public. This is from Tempe, Arizona. This is their public interface. And you can see they have the area divided up into several sewer sheds there, delineated by their different color. Each of those areas are serviced by an individual wastewater reclamation plant, and they do samples from each of those areas. And then on the graph to the right, you can see those individual areas and then the gene copies, COVID-19 gene copies per liter of wastewater over different time periods. So using the wastewater surveillance data, you can get an idea of not only what the trends are over time, but also the trends in individual areas of the city. And again, this is a public dashboard. So right now we're analyzing our data. I'm not going to present any of that today, but we are seeing the lag time, as other people have found. It varies quite a bit, it seems, between wastewater treatment plants. So it can be very short to up to 6 days. We're also looking at trying to figure out the best metrics to relate to the wastewater data. For example, there may be a stronger relationship between wastewater data and case positivity rate than just general infection levels in the clinical data. So we're examining those questions as well. Again, so at this time, I'll just take any questions or whatever's next on the agenda.
Mark, we do have a question for you. What are the units for viral load, and can an estimate for the number of untested yet infected people be generated from this?
It's copies per liter of wastewater is the unit of measure. And yes, that is, so the next question is, yes, that's a very important question, is basically how do you relate this wastewater concentration to the rate of infection within the community that sewer serves. That's sort of the holy grail question of this study and many other studies that are involved in this worldwide. And again, it's a complicated question. And so I don't have an answer to that right now because no one does. Okay. We're still working on that. Trying to develop a model that can estimate community infection rates based on the wastewater concentrations. It's going to vary by sewer shed. It's going to vary by the population type. There's a lot of different factors that are going to change it. It can vary throughout the year. So again, warmer conditions, for example, the virus may degrade faster, the viral genetic material. That's going to affect your model output. So it's a complicated question, but a very important one.
And I have a question. You mentioned genetic sequencing, and that is how you're going to test for variants. Is that being done currently, or that will be done in the future?
It's being done by other labs, and we're doing it right now. We just started doing it in the last week, I believe. Okay. It's, you have to get the right methods for this. I was surprised actually that there aren't better established methods for doing some of this work. But we consult with other scientists all the time, and it's an ongoing process. The most efficient way to not only detect the virus, to prepare the samples, for example, sewage is a complex matrix. So just the question of what's the best way to prepare the samples, to extract the RNA from the samples, that's a complicated question in itself. So those methods are still being worked out in real time.
Okay. Josina, I'll throw it back to you.
I think we'll open up questions for Dr. Ezike for either speaker. If there are any questions, you could throw them in the chat. Let's see.
I have a question about the U of I saliva test. I know that U of I, University of Illinois, is using a saliva test for their students. Could Dr. Ezike speak to that? And your thoughts, the effectiveness, or widespread use? I'll just open it up to either of you. Dr. Ezike, you're muted.
But I'm smarter when I'm muted. No. So the saliva test has been wonderful. It kept the test positivity rate at U of I down to under 1%. They had so few cases because of the effectiveness of this. We are actually at IDPH teaming up with the saliva program from U of I under the SHIELD program to extend this testing capability to all of our schools, K through 12, and trying to bring that testing capability to schools throughout the state. So we are actively enrolling schools, reaching out to schools saying, we think that testing might still be with us for a while. And so trying to use this is easier than the nasal swabs. The results come back fast and it's highly accurate. So we are trying to expand this. I think there are other colleges that will be using it, and we are definitely expanding it through K through 12 as well.
Yeah, and I think the wastewater-based approach is also really, really useful in college settings. It's much simpler than in trying to do a citywide surveillance system, because if you can just sample a sewer draining an individual dorm building, for example, again, you can monitor that entire dorm. It's a very sensitive test. So even if a few individuals are infected, you'll likely detect it in the wastewater.
Okay.
So you can detect things very early on.
So my question is, someone texted me this question, but that we were talking about contact tracing a lot in the early days of the pandemic. And we haven't heard about it that much lately. Does it not play a role anymore? Or have we thought that kind of approach was not as effective as we thought?
So, this has been a continual, play and learn and get better at the game. We initially thought contact tracing would be very central, and it is an important part of any kind of disease intervention system to identify who is infected, let other people know that they could have been exposed. There are a couple of things that we learned from this. First of all, in some cases, people didn't want to be identified. They didn't want to be told that they needed to quarantine for whether it was going to be 14 days or 10 days or the 7 days. There was some disincentive for people, there were equity issues. If I am going to lose my job because I now have to stand down for 10 days, it's not in my best interest to cooperate with contact tracers. If I see the call and I see the caller ID and that's this, that maybe I don't want to answer. So there were some issues like that. And then at some point when we were in those significant surges where the cases were thousands, tens of thousands a single day, we just didn't have the amount of staff at all of the local health departments to even keep up. But as the numbers come down now, and there are manageable numbers, contact tracing actually has a very significant role, because then, there's only, I think today maybe about 1,300 cases. I have to look about maybe 1,300 cases, which is a far cry from when we had 15,000 cases in a single day. So being able to actually contact trace every one of those, identify, who their contacts are, and let those people know that they should, look out for symptoms, that they have been identified as exposed individuals, really gives us a strong tool to slow down the transmission of this disease even further than the low levels that we're enjoying now. So it's not gone. We still have contact tracers throughout the state that are doing this work. We're hoping with these lower numbers, we can even be more effective in the use of this important mechanism.
Thank you. Mark, did you have anything to add to that?
Yeah, that's my feelings exactly from what I've read. I was just actually reading about Australia this weekend, and they're using wastewater-based epidemiology, and they've had relatively low case levels. They've done a very good job controlling COVID, but they still did wastewater-based epidemiology because whenever they did see an uptick in the wastewater, they would immediately deploy testing and case tracking resources to those areas. So they could stop it very early on. Because again, the contact tracing is really essential to get it early when it's not really widespread. That's when it's most effective.
Okay. We have a question from Michael Lev. With the use of combined sewers in Chicago, how convoluted does that make testing when it does versus does not rain?
Yes, that's exactly an issue. So yeah, you have to basically normalize the concentrations for not only the flow from rainfall or something like that, but you also have to normalize for different levels of sewage in the water. And there are various ways to do that. There are markers of fecal material that you can use to sort of normalize the different levels of sewage throughout the day, as well as things like rainfall. You just have to normalize that using the known flow and things like that. So yes, it's an important issue.
We have a question from Justin Hart. His question is, you mentioned the possibility to use sewage surveillance for looking for more than just SARS-CoV-2. Is Argonne looking to add other targets?
For this particular project, we're not. This is just focused on COVID. However, like I said, this method is being used for a lot of different things. If you look, for example, drug use, you can look at opioid levels, concentrations in the wastewater to get an idea of community drug use. A lot of different health biomarkers, hormones, all kinds of different things you can use using this method. So it has a lot of different applications. Antibiotic resistance genes, that's a big area that this could be used for. So yes, there are a lot of areas we'd like to apply this to.
Okay. John Herhoff has a question. Could we use this type of viral testing in the future to track where flu outbreaks are occurring locally and provide public notices so people can maybe better mitigate their risk?
Yes, it would be applicable to that as well. Again, the idea is, what level of resolution can you get, and is that cost effective? It's probably not cost effective to sample every single manhole in the city every single day. So you really it's really a balance between resources and what information you get from it. But theoretically, yes, it'd certainly be applicable to the flu.
Dr. Ezike, did you want to see, would this make your job easier?
No, if you can make that work, you can imagine, if people haven't burned all of their masks, you could say that, oh, look in this area, we see that there's rising flu activity. And then people could selectively say, wow, if we know the flu is circulating more, maybe this is the time that this community should be wearing their masks to help prevent the transmission of that. We saw how effective the masks were at completely gutting any kind of serious flu numbers, flu hospitalizations and deaths. So if we had an early warning that something was on the rise, that could be your time to say, okay, I'm going to reunite with my mask, and I am going to try to prevent myself or my community from having this flu epidemic, this flu outbreak grow.
Okay. There's a question, is there a plan for the state's Department of Public Health to more closely work with water reclamation plants and use WBE methods to establish long-term surveillance programs and have something in place for future pandemics?
Absolutely. That's exactly the plan. We are, we're starting small, and we are going to expand throughout the state to have surveillance throughout the state. This is for COVID right now that we're trying to look as we see, we don't know what curveball we will be thrown, what's next in our COVID journey. But with this wastewater surveillance, we can keep an eye rather than, maybe always just testing the entire population over and over. This can give us that early look and give us that early signal. So we absolutely plan to use that.
Okay. What IDPH what is IDPH doing to monitor double mutation variants, which are spreading in some countries currently? And are vaccines effective against it?
Right, so we are monitoring by our genomic sequencing off of our PCR samples. So we didn't have at IDPH the capability to do genomic sequencing. We relied on partnerships with other scientists and labs in the state and even outside of the state. But we have now ramped up that capability within the Department of Public Health as of just March. We got the appropriate equipment and are working with the right staff to do genomic sequencing in-house. So now of all the PCR samples that come into the state, we are doing the genomic sequencing on about 6.7% of all those samples. I think the nationwide number is only 1% according to the CDC. So we're continuing to ramp this up to give us a really good idea. All of these sequenced samples are then tracked in a national registry system that tracks all the samples that were sequenced in Illinois. And so we can see what percentage of our samples are B117, which one are the P1, which one are the B1351, how many samples are the ones that were identified in India. So we will be able to see even new ones that have not been identified or named or classified. Those will go into that directory so that we can see if something new starts to bubble up.
And can the general public access this directory?
I think the GISAID registry, I don't know who has access to it. I think it might be on the CDC website. I'm not sure who has access to it, but it is a registry that we can see other, I think we can see other states' information as well. So GISAID, we can see where that's located. I don't know if there's special passwords that other people need to get into it.
Okay. Does the U.S. Public Health Service have a role in wastewater surveillance in Illinois?
Yeah, we have, a partnership with the U.S. Public Health Service in terms if we need resources, we can turn to them as well. We have used resources from USPHS. I don't know if I have anybody from there who's directly involved with wastewater, but that's not something that couldn't happen. It absolutely could happen. And we're always open to these different partnerships with so many of our different local and federal agencies.
So, yeah, and I think the NIH is looking to set up a nationwide sewer surveillance program for the long term. I'm sure Illinois could be a part of that.
So one of the questions is, people are excited by the fact that if they're fully vaccinated, they can take off their masks. However, it does rely on somewhat of an honor system. And since a vaccination report card isn't necessary yet, what are your suggestions and recommendations on how to handle this sort of tentative position that we're in right now?
That's what all of our conversations have been about, definitely since the announcement came out, kind of as a surprise. But the truth is that for the people who are fully vaccinated, they should feel confident, that their vaccine is protecting them. But we do know that there is a small percentage, maybe 3 to 12% of people who may not, have the expected or desired immune response. And some of those people are more likely to be identified in terms of people maybe who are cancer patients, people who are on immunosuppressive agents, people who take chronic, steroid therapy, people who have had an organ transplant. So those individuals obviously should know that there is some concern that they may not have the full protection, and so therefore might want to continue masking, might want to use the N95 mask if they have to venture into more crowded areas where you're not sure of the status, and some of the people who are not vaccinated may be unmasked. And so there are some personal decisions that people have to make given what they might know about their own health status. And just in general, like, nobody should be shamed for continuing to wear their mask. Depends on, how you are in terms of risk taking. You might be more comfortable continuing to wear your mask, or avoiding some of those settings where there might be too many people who you're just not sure of the vaccination status, while there still is, a decent amount of virus in the community.
Right. Another question is, early on, there was discussion that children were less likely to contract the COVID-19. But currently we're offering vaccines to the 12 to 15-year-olds. So some people have a disconnect in terms of they thought that children couldn't get it, but now we're vaccinating. Is that because they could carry it and transmit it? Could you speak to that?
Yeah, that's a great question. And let's be clear that we started off dealing with the COVID-19 disease, which was that initial novel coronavirus that we hadn't seen before. Now, we know that we have gone through different versions, the variants. So the virus that we first met in 2020 is not the virus that we're dealing with now. And so there are new properties of the different variants of this virus that we're dealing with that are different from what we understood of the variants that we first became acquainted with at the beginning of last year. And so we have seen with the new circulating variants that there is more transmission in kids. So there are properties that have changed. The spread is more aggressive than it was a year ago. And we're seeing sicker people, even younger people who are being hospitalized. So it's part of the reason that it's appropriate to vaccinate kids is, first of all, we need it for the herd immunity, but we do know that kids can get the virus. We know that they can transmit the virus. And we do see that there's more sickness and more severe sickness, even in younger individuals with these newer circulating variants.
Okay, thank you for that. So here, this is a really important question, and everybody wants to know this. We want to know, Dr. Ezike and Mark Grippo, how have you stayed sane during this pandemic, and what have you done to relieve stress?
I can start. So first of all, there's an assumption in there that I have stayed sane. There's very, might not be correct. I have had some moments of complete insanity. Therapy has been my friend, and a very supportive community and family. I have tried to recenter myself, but with me, that prayer and meditation, physical activity. I love competitive sports, specifically competitive tennis. So trying to make sure that I stay with that when I can on the weekends has been helpful, but it has been quite a challenge.
Thank you.
Yeah.
Mark?
Yeah, I would just like to second that. The physical activity is just really important. It's so easy to just kind of sit down all day, even in an office situation, let alone, being at home. So physical activity is really important.
Okay, thank you so much. Josina, did you want to? I think you're muted.
No, I just thank you. This was really interesting. We're again so proud to have been part of the early research on this, and the fact that the potential to be part of the solution continues to grow. It's just been a really rough, I think, to your point about, have we all stayed sane? It's been a rough year. I have 2 kids under 3, had a baby during the pandemic. We've all, unfortunately, likely lost somebody or have seen people struggle with this. And, to finally see, some hope and some light at the end of the tunnel, you know, and to be able to be even a tiny piece of that is so meaningful for us at MWRD. And again, you know, thank you to Mark and to Dr. Zeke and many of you I see on the Zoom who have been part of getting us to where we're at. You know, I can't imagine living in any state other than Illinois over this last year. Again, just really want to thank everybody for their leadership, for their work, for being a model of how to kind of try to move through this situation with as much grace as possible. And look forward to continuing to work with everybody on, you know, trying to continue to find ways to use this particular tool, but everything that is at our disposal. I know we're still at all of the above, you know, situation, and that there is no, you know, I know people talk a lot about what will a post-COVID world look like. I don't know if we're ever going to be in a post-COVID, but as much as we can find ways like testing for COVID and wastewater to find a way to normalize and be as proactive and smart as possible in managing this is great. So thank you again to everybody for their work, for being part of this conversation. And thank you to Mariyana for being a partner on this.
Yes, thank you everyone for taking part in this town hall. Thank you, Dr. Ezike and Mark, for sharing your knowledge, your wisdom, and guiding us through this. If this pandemic has taught us anything, that we are not alone, we're all in this together. Just check on your neighbors and friends, make sure that they're okay, stay safe, and get vaccinated. Thank you, everybody.